Hello, everybody. Angelique Montano Breslin here from Proactive Pelvic Health Center. And I am here today with Makayla Mcintyre, who is our newest addition to the PPHC team. Makayla is a somatic practitioner as well as a pre and postnatal yoga teacher. So I'm pretty stoked to be chatting with you today, Makayla, because I am really intrigued in the offerings that you have to support our clients at Proactive. So thanks for taking the time.
Thank you. I'm so excited too. I can't wait to be a part of everything.
So why don't we start off simply by just talking a little bit about your background and how you got into this area of practice and sort of what you've done up to this point.
So, I've been practicing like yoga and meditation for about 10 years. And then about 3 years ago, I decided to start doing my teacher training. So, I'm a 500-hour yoga teacher and then certified as well separately in prenatal and postnatal yoga. And then most recently, I did my somatic practitioner training. So I'm most excited about that right now. But I've been teaching yoga for about 3 years, a variety of styles, as well as prenatal yoga. And I would say my biggest passions with teaching would be primarily around regulating the nervous system and just supporting more relaxation. And, in this day and age, we don't get enough of it. So I think that
Mhm.
I would say that's kind of my priority right now is
Yeah,
helping people find rest.
absolutely. So important in our Western society generally, right?
Yeah, exactly.
Uh, and I think when we look at the pelvic health, sort of population, it is a
Hmm.
big piece, whether we're dealing with the perinatal population or people that are struggling with more, pelvic pain or complex pelvic and sexual pain.
Yeah.
The nervous systems really do get super ramped up,
Hmm.
and contribute to a lot of the symptoms that they experience.
Exactly.
So yeah, so I think it's very, very important to address this piece. I think people generally think more about just treating things on a physical level as opposed to diving deeper and getting a sense of what's going on inside, what's going on in the nervous system. So I'm really excited to talk a little bit about somatic because again, I'd love to learn more about that piece.
Yeah.
It's not something that's really offered and is really, well known in the general
Hmm.
public. But before we talk about that, let's talk a little bit about um, pre and postnatal yoga. So can
Hmm.
you share with us a little bit about what are some of the key benefits for someone in pregnancy and postpartum? Like how are you able to assist that population?
I would say the key benefits would be, I mean, aside from the kind of the obvious of helping with the tension and like just physically supporting as far as the pain that you might be experiencing or just discomfort
Mhm,
in different parts of the body like low back, the hips, the
mhm,
shoulder, the neck, like those tend to be a lot of areas that you might be carrying
mhm,
tension.
mhm,
So just finding different comfortable positions that can help with alleviating some of that tension without pushing,
mhm,
as well as that you can still help build strength in small ways, helping with building core strength, pelvic floor strength,
mhm,
just in small ways but without overwhelming, without making it too much. And it is something that is still safe for beginners, which
mhm,
not a lot of movement is. In prenatal, it's you can do it, but it's not necessarily safe to start a whole new type of exercise. So
right.
yoga is something that is beginner friendly, is advanced friendly for
Mhm,
prenatal, especially for postpartum as well.
mhm,
It's a great option for gentle movement, slowly easing back in, finding a little bit of strength, but still even just the nervous system component for that as
mhm,
well for both, like finding relaxation, finding moments for yourself.
mhm.
Even like preparing for a baby is a lot of work. And
Yes.
sometimes even just that hour is like, oh, wow, you set up a
Yes.
week.
Yeah, and again, back to that whole, we support people physically,
Mm-hmm.
from a physio perspective, from even a yoga perspective, but
Yeah.
we don't really give the importance that we should to
Mm-hmm.
prepping on a more psycho-emotional level, right? Which is what you're saying as far as
Exactly.
relaxation and the nervous system in that sort of prenatal period in
Mhm.
preparation for labor, right?
Exactly. Even just being able to give space for like the mind and the body to slow down. And
Mm-hmm.
sometimes I find like those intentions, those goals, like what you really want to see out of your pregnancy, what you really want to see out of your like postpartum experience, when you give space for
Mm-hmm.
that, it kind of comes to light a bit more of like, oh, that is what I want. And sometimes
Yeah.
it can be difficult making so many decisions. Like every day you're, do I do this thing? Do I do that thing? And then
Mm-hmm.
sometimes all it takes is just a little bit of time to slow down, and all of a sudden you're like, oh,
A little bit of
obviously.
space. Yeah. And it just
Exactly.
comes to you,
Obviously
right?
that's what I should be doing. Obviously that's what I want, but
Right.
it's easier said than done. You need,
Right.
you know, we all just need a space to slow down and take that
Mm-hmm.
time.
Right.
Yeah.
Okay. Yeah, makes sense.
Yeah.
So can you share a little bit about, new and expecting moms who would like to work with you, either in a class environment or a one-on-one yoga session? Like, what can they expect from a session with you?
I would say so a little bit different from both, but I would say for the group, the main thing that I would say is like the benefit or like what you can expect is community,
Hmm.
connection, being able to meet other people that, you know, making new friends, either new moms or expecting moms, and just being able to kind of fill up that circle, be able to ask questions, you know,
Hmm.
make connections in that space.
Hmm.
And then privately as well, there would be a lot of the benefits too if you have any like specific goals or anything that you want to work on, any intentions or like mental preparation. Like we said before, it's more than just the physical component of course, like, you know, if you have anything unique that you want to work with, then that
Hmm.
like one-on-one is a great space to be able to do that for the physical body. But for the emotional, you know, there could be just anything that you're working through that you want to hold space for,
Hmm.
and maybe learn extra breath techniques. That would be,
Hmm.
you know, going for both breath for, could be breath for relaxation, how to find
Hmm.
just moments of peace throughout your day, even if it's for a few minutes
Hmm.
before or after labor. This would be the same for finding breath techniques that can be used during labor as well,
Hmm.
picking and choosing which ones you like, which ones you want to
Hmm.
practice, which ones resonate, as well as just better sleep is
Yeah.
feedback that we hear a lot, even just aside from the, again, the physical tension,
Hmm.
that helping release that, because that can be a huge factor in like finding difficulty sleeping, but on top of that, the relaxation,
Hmm.
you know. Yeah.
Hmm. Yeah, and especially, when you're speaking about sleep, when it comes to the pre and postnatal population, you know, new and new moms and expecting moms can certainly use a lot more of that, I generally
Exactly.
speaking, right?
Yeah, get the full rest advantage, even if it is in a short period of
Yes,
time, but being able
yes.
to find like full comfort in your sleep and a little bit more relaxation there for
And
sure.
so important for healing too after childbirth, right? For the
Yeah,
body and the mind, everything to just physiologically come back to balance. So, um,
absolutely.
huge. Sleep is so, so important.
Yeah.
Um, Okay, so I'd like to share with the group or whoever is watching this right now that Makayla will be hosting her first pre and postnatal yoga series, which is a 6-week program. And that is going to be starting in mid-April. So please uh, check out the link below, um, or wherever you're watching this to get more information on that. And if you're interested, by all means, to register. Was there anything you wanted to, mention about the class series that you'll be hosting?
I would say, well, besides the fact that I'm very excited, but just some things to kind of keep in mind is we'll be working a lot on breath techniques as well as, you know, just of course the movement, the yoga piece, but also focusing on kind of movements that you can use at home as well. So kind
Mhm.
of things that you can keep in mind for what you could use when you're at home and you're feeling tension in that same
Mhm.
area. And then we'll also be doing a lot of like themes, like weekly themes for, like we said, the emotional, the mental side of it, of preparing,
Mhm.
yeah, preparing or afterwards. Yeah.
Yeah. Okay, so we will certainly share more information on that if you're all interested.
Yeah.
Okay, so next, let's talk a little bit about somatic therapy. Because
Hmm.
Makayla, I don't know about you, but I don't know a lot of people that really even know what that means.
Yeah, I would agree. I'd say
So,
it's very new and it's,
yes.
maybe a word people have heard before, but I
Hmm.
don't know a lot about it. And I will do my best to put it into short words rather than making this like a 3 hour thing.
Okay.
Yeah.
So tell us a little bit about what it is and how it could benefit, especially pelvic health.
Hmm. I would say kind of the key component would be the nervous system. That would be the main purpose.
Hmm.
But on top of that, it would be just body awareness and being aware of sensations in the body. So I would say that's kind of the center of somatic therapy. So to talk a little bit about the nervous system component would
Hmm.
be somatic therapy is rooted in like the polyvagal theory. So just the autonomic nervous system. I won't go too much into the details of it, but to sort of something that can happen oftentimes in like with pelvic health issues related to the nervous system or just nervous system dysregulation
Hmm.
is you it becomes difficult to know what is safe and what is unsafe, where the nervous system can set off for things that don't need to be set off.
Hmm.
So the best kind of thing that I like to use to explain that is like the alarm systems in the body.
Hmm.
Maybe at some point something happened that triggered, an alarm system that needed to be set somewhere in the body
Hmm.
to kind of make you extra aware, maybe a little more protective. And that's meant to protect you. So this is a great tool. This is the nervous system
Yeah.
doing its job and helping.
Yeah.
But then sometimes what can happen is we feel sensation. So it can be something that's not pain, but sensation. And then the nervous system goes, I felt that before. Put another
Yes.
alarm, like put another one over there. Like,
Yeah.
you know,
Yeah. Yeah.
or it could be not even just sensation or pain, but something mental that reminds you of a thing. And then all of a sudden it's, oh, let's just add another
Hmm.
alarm system. And next thing you know, you don't just have them, on the doors of your house. You've got them on the windows, you've got them like,
Hmm.
by the light, you've got them everywhere.
Hmm.
And somatic is kind of coming back to the body, coming back to the sensations that you're feeling, and kind of making that mind body connection of, in this example, let's say, okay, we're thinking of one of these alarm systems that we have. Is this one necessary?
Yeah.
Like, do we need this one? Does this one resonate? Is this
Hmm.
something that we really need to hold on to, or can we let it
Hmm.
go?
Or
And
is it just being like an overprotective um, parent, right?
yeah,
Or like a helicopter parent, like which
exactly.
it's
Like,
not necessary, but your
mhm.
body is in this overprotective mode.
Yes,
Yeah. Yeah.
exactly. So it's of course we're not trying to get rid of all the alarm systems,
Of
they,
course.
they serve
We
a
need we
purpose.
need some of them, right?
Yeah, the nervous system is great even when it's, maybe doing things it shouldn't be. It's serving a purpose.
Hmm.
But overall, we're just trying to kind of come back to the body, come back to our own sensations, our own beliefs.
Hmm.
And is this necessary to hold on to, or can we let it go? Essentially,
Right.
is kind of the best way to sort of explain that part of it. And then the body awareness comes in with, disassociation, disconnection, especially with pelvic floor, like whether it's, hyper or hypotonic pelvic floor, it can go both ways of like
Yeah.
disconnecting to the body. And this doesn't always have to be like pelvic floor disconnection. This can be the body itself, like just
Hmm.
completely disconnected.
Hmm.
So this just kind of helps without jumping right into, especially in the beginning, like the big sensations or the big
Hmm.
things that you want to work on. It's the little sensations. Is how can I connect to the small sensation that I feel in my hand, whether it's good
Right.
or bad, whether it's like positive sensation or more negative sensation. It's still just connecting
Hmm.
those two pieces and finding little moments in your day where you can associate maybe a physical sensation with an emotional sensation.
Hmm.
Like if you think of, let's say, anger, a lot of us feel it in our body, but sometimes we don't even realize that we're feeling it. Your face
Yeah.
gets hot, your
Yeah.
hands get, clammy and tight. And
Yeah.
you're feeling anger, but sometimes we're so disconnected from the physical sensations we have in our body to the mind that we
Mm-hmm.
don't even realize we're angry. Or we're
Mm-hmm.
like, why is my body being why am I all
Mm-hmm.
tense? And all of a sudden it's like, oh, because I'm upset or because
Right.
I'm sad. Or it's just
Right.
kind of helping to bring those two pieces together
Yeah.
to make it a little bit smoother to go through your everyday.
Yeah.
Yeah.
And I think anybody who's listening to this can absolutely relate to some of those examples that you shared.
Mm-hmm.
And especially, when I think about it in my own pelvic health practice, this is very common in individuals that struggle with complex pelvic or sexual pain or
Mm-hmm.
have histories of trauma, whether it be physical, emotional, sexual, whatever it is. Uh,
Mm-hmm.
and a lot of these sort of sensations and responses and feelings that all get all jumbled up, and we sort of lose um, the sense of what is balanced, what is our normal
Mm-hmm.
sensations, or how should our body be um, reacting and responding to these inputs, right? Um,
Exactly.
so I think it can be such a valuable um, type of therapy for people that have histories like this.
Yeah, exactly.
Mhm.
Even just learning, like helping to learn the difference between sensation and pain
Right.
is a big
Yes.
component because
Huge.
they feel the same. Like when the
Yeah,
nervous system is dysregulated, it's the same thing. I
absolutely.
don't want to say that to invalidate it.
Yeah.
It's
Yeah.
always pain,
Yeah.
but
Yeah. Yeah.
it is when the nervous that is how it feels to the nervous system. The
Yeah.
nervous system makes it so that they are the same thing.
Hmm.
But sometimes I think we can bring it back, like when we regulate the nervous system with breath techniques, with different tools.
Hmm.
um, Eventually the body starts to recognize the difference a little bit better.
Right.
Yeah.
Yeah. And I truly believe that that is so valid and so supported by the science around pain, right?
Mm-hmm.
Because there are clients that come into my office and they initially could present with a lot of pelvic floor dysfunction. And
Mm-hmm.
we sort of treat that with pelvic physiotherapy. And in some cases, that is the main driver and the pain starts to subside. In other
Yeah.
cases, we can improve all the sort of myofascial tissues, but the
Mm-hmm.
pain is still there. And that's where, sometimes I try to explain to my clients, your pain can manifest and be driven by our muscles and our soft tissue, but our
Mm-hmm.
pain can also be driven by our nervous system. And I think sometimes that's the missing link for a lot of people that are struggling.
Exactly. And it's hard to know the difference because
Yes.
it feels the same. You're still
Yeah.
feeling like you are experiencing pain, but
Hmm.
it's just the difference between, like you said, like that muscle
Hmm.
physical pain and the nervous system setting something off as pain so that
That
you
feels
recognize
the same.
it.
Yeah. Yeah,
Yeah,
for sure.
exactly.
Oh gosh, this is so exciting.
Yeah.
I'm really excited for this
Me
because
too.
it is very much the missing link for a lot of people, right?
Yeah.
So can you tell us a little bit about what somebody can expect if they were to work with you one-on-one in a somatic therapy session?
Yeah. So I would say generally every session or every one-on-one is going to look a bit different, but they'll always start with intention setting. So even if it's for that day, setting the intentions of what are we trying to work on today, or just intentions of in general.
Hmm.
Obviously, consent, comfort levels, assessing where you're at that
Hmm.
day because it's going to be different from where you were at at another session.
Hmm.
But besides from that, the actual like work that we would be doing would depend on what the like client preference is. So it
Hmm.
would varies from breath techniques. So some people feel comfortable working a lot with the breath.
Hmm.
Other people do not. Some people we doing more movement based.
Hmm.
So this could look like almost like a variation of yoga,
Hmm.
so like somatic movement. Just this could be listening to your body and how it wants to move, or it could be instructed movement, whichever is more comfortable. Or there's even a whole other range of somatic practices and techniques that are not movement or breath related.
Hmm.
These would be like more in the mental, visual sort of aspect of things.
Right.
Just depending on, I would say normally we start with one, and then as the client maybe is more comfortable to to work with another one, or we can kind of slowly incorporate
Hmm.
and see where we're at. But I would say that would be what to expect during the actual session.
Hmm.
Um, and also this mean like, I guess something to preface is that even if the intention is that you're working with trauma, this doesn't mean that you have to work on the trauma.
Right.
We're working on the small other
Yeah.
things that are related, but without
Hmm.
we're not diving deep,
Right.
especially like right off the hop, things might come up, but we're starting on the very low, assessing sensations in the body,
Hmm.
assessing like the mind body connection, and just sort of easing the nervous system.
Hmm.
So I just, yeah, I wanted to put that out there that it's
Yeah.
even if it is working a lot with
Hmm.
like trauma recovery, we're not unpacking, we're not
Right.
reopening, we're just
Yes.
working on the nervous system side of
Right.
things. And I would say in general, even sometimes, you're going to be working on the emotional stuff mentally that comes up through the movement or through the breath.
Hmm.
But then we always, afterwards kind of take a second to reset the nervous system
Right.
and come back. And then I would say, in general, kind of once we've done the actual practice, then we would be looking at any maybe possible homework for the week,
Hmm.
depending on if that's what they want. But this could look like journal prompts. It could look like, um, are we going to try this activity that we did
Hmm.
at home? This could be like the breath techniques or movement.
Hmm.
Or if we worked on maybe some journaling options, it could be stuff that you take home that way.
Hmm.
There's lots of printouts that I have. So it would just depend on, if homework is too much, depending on how
Yeah.
many other things you have going on,
Right.
that's okay too.
Yeah.
Um, but it doesn't have to stop in the session necessarily. So
Right.
then I would say that's kind of where we would recap it off. Yeah.
Amazing. Oh, that's so great. Thank you so much for sharing that and for explaining that. I think it gives a lot more insight into how you can support clients.
Mhm.
So if anybody out there is interested in exploring either pre and postnatal yoga classes or one-on-one care with Makayla, please feel free to give us a call or to book a session with her online. She is available now to see clients, and you are working, you're going to have to remind me,
Thursday.
Thursdays at Proactive Pelvic Health Center. Makayla, thank you so much for your time. But before we wrap up, is there anything else that you'd like to share?
I would say the best thing to do if you're interested in this somatic therapy would be to start with the 15-minute discovery
Right.
call.
Mhm.
This would just to be to see if it's a fit for you, ask any questions that you might have. So I would definitely say that, especially for the somatic therapy, that would
Mhm.
be, the best way to start if you're interested.
Right.
And then from there, looking at like the sessions, just to make sure that it is what
That's
you're looking for and it
exactly.
be helpful in your scenario. Yeah.
Right. Yeah, great point. That's absolutely great. And those virtual consults, the one-on-one
Mhm.
15-minute complimentary consults are available on
Mhm.
our online booking. So if anybody
Yeah.
is interested in that, please go ahead and you can book that online or through the clinic.
Yeah.
All right, Makayla, thank you so much again
Thank
for
you
your
so much.
time, and we'll see you soon.
Yeah. See you soon.